My name is Sharad Rajpal, and I'm a neurosurgeon with a spine focus. I was one of those classic kids who had grown up. I was actually very young and used to travel to India to see my grandfather, who was a general practitioner in a very small town. He would provide care for the entire town, and it was 24/7. He was very dedicated, very passionate about managing all the people around him. I watched that and I decided I was going to be a physician. So obviously followed that pathway, but it was not a straightforward pathway to becoming a neurosurgeon. I was actually going to become a general surgeon for a little bit and then followed neurosurgery as one of those passions after learning more about that specialty. I think the most important thing for us is to be able to provide patients with the ability to get back to their normal lives. We generally will see them in a very vulnerable part of their life, so they're suffering from some type of pain in the neck, the back, and obviously it's affecting their quality of life. That's what brings them in to see us in the office. What's unique about what we provide to our patient care here? So first of all, we have a dynamic team that really sort of involves advanced practitioners in our clinic.
Good morning.
So when a patient comes in for their initial appointment, I want them to feel welcome. It's important to understand that we work as a team for providing care for our patients. And no two patients are alike, so the challenge is constantly being able to provide them with a unique experience, unique care that's tailored to what their problem is. And then also being able to, in the field of neurosurgery and spine, is being able to incorporate the latest technologies and advancements and treatments to be able to provide them with care that's up to date and the latest. I have some of the most advanced experience and training in some of the platforms that are out there that we use in surgery. So that would include things like artificial intelligence, machine learning, customized rods to patients, and actually using technology such as a robot to perform my surgeries. So rather than taking the patient and sort of fitting them into how are we going to use the technology, we can customize that to the patient intraoperatively, provide a surgical solution for the patient that's customized to what their problem is, and then also analyze that data and make sure that what we're doing is we're doing better, not only from the patient standpoint, but for our outcomes as well.